Hello. So today I'm going to talk to you about pyometras in female dogs and cats. I kind of wanted to go a little more in depth on some of the things that were listed in the pros and cons of spaying and neutering for animals. So a pyometra is an infection in the uterus of an animal. And it is usually pus, white blood cells, bacteria that's in there. The kind of classic or typical is it happening 2 months after a heat cycle. Really, the range is more like 1 to 3, but the average is 2 months after a heat cycle. And you can get a wide range of clinical signs associated with this disease. You can have animals that are vomiting, diarrhea, anorexic, fever. I've seen a couple of dogs that the only thing they showed was they were drinking more and peeing more. You can get discharge from the vulva of the animal, those types of things. There's 2 different types of pyometra. One is called an open and one is called a closed. And what they're describing with that is the cervix itself. In an open pyometra, the cervix is open or dilated. So some of the material is able to come out and drain. In a closed pyometra, it's closed, so it's just backing up pus into the body. So our classic treatment is to spay the animal. If you eliminate the infection source, then you fix the problem. There are injectable and medical options for treating pyometra without spaying the animal, but typically we save those for dogs that have really good genetic potential or are championship breeders or something to that respect, just because the treatment is expensive and it is dangerous. I have seen dogs almost die from that treatment before, and they are at an increased risk of having pyometra again on the next heat cycle. So kind of the complication that comes with pyometra, it's not like doing a healthy spay on an animal. The animal is sick with other things. So typically when you have or you're suspicious of a pyometra, we're going to start with blood work. Your classic look is going to be really high white blood cells on blood work, but I have seen pyometras with normal white blood cells. We're really looking to see, do they have enough platelets? Can they handle surgery without bleeding? Are they having any issue with their liver and kidneys? Because you can have other issues you have to treat at the same time. Usually they're going to get strong antibiotics, strong pain meds, those types of things in surgery, and rehydration, because those dogs are typically dehydrated, or cats. There are some times that we will do things a little bit more on the cheap, where we will spay and send home oral medications and not do hospitalization. It's kind of up in the air of how that's going to go. There's the classic kind of thing that we're taught in vet school that says never let the sun set on a pyo, which essentially means you should do surgery on the same day that you find it. That's not always an option though. So it's one of those things that if you're concerned about the potential of a pyometra for your animal, get them in, get them seen, get some blood work done, get some imaging done, and see if they need something like emergency surgery. I am 100% of the belief of if you cannot afford an emergency pyometra surgery, your animal should be spayed. You don't have to worry about it. The reason I say emergency is because it always seems like if they're going to have an emergency, it's on the weekend, it's on a holiday, it's during an ice storm where nobody's at work. It's never when it's convenient. So